The question for this week is, what about the role of antibody therapy in myeloma? Well, antibody therapy is definitely an exciting new approach to myeloma therapy. The antibodies are called monoclonal antibodies and are humanized, which means that these antibodies are acceptable for patient treatment. Right now, there are two monoclonal antibodies which are moving forward in clinical trials. One is against a substance on the surface of marrow cells called CS1, and the other is against a marker on the surface of myeloma called CD38. The first of these monoclonal antibodies, elotuzumab, is the anti-CS1 monoclonal antibody. This is exciting not because it has direct activity against myeloma, but it has remarkably strong activity in combination with Revlimid and dexamethasone. And trials have been going forward with this combination of elotuzumab plus Revlimid and dexamethasone, both in the relapse setting and more recently earlier in the disease. The results have been promising, and it seems likely that this will potentially move forward in the not too distant future for potential FDA approval. The second monoclonal antibody, anti-CD38, is one in which there are actually three variants of this monoclonal antibody. And this perhaps expresses more clearly than anything the excitement about this CD38 target, so that there are actually three separate companies with three different monoclonal antibodies. The one which is furthest along is a monoclonal antibody called daratumumab. Quite a challenge to say. Daratumumab, I'll say it one more time. This is owned by the company called Genmab and is very exciting because it does have direct anti-myeloma activity as an antibody in phase 1-2 trials. And so people are particularly excited about this, and it does have what's been called breakthrough approval status, which means that the FDA is very excited that this may move forward rapidly for FDA approval. The two other monoclonal antibodies against CD38 are MOR202, which comes from a German company recently acquired by the Celgene Corporation, and then also another antibody which just has numbers, which is under investigation in combinations from the Sanofi company. And so these are very, very exciting developments and very encouraging. And so I think that we can expect to see one, two, or maybe more monoclonal antibodies as part of the armamentarium against myeloma, using a completely new mechanism of action. And so this is what we're looking for, new types of ways to attack the myeloma. So a very promising new approach.